Health Science Center in Fort Worth, the hospital's problems went well beyond the ER.
The hospital was in the red on an annual basis. The patient satisfaction was very low. The employee satisfaction was very low. And across the board, what we heard from people was that this used to be the community's hospital, and now people are leaving the community to go get their care elsewhere.
The troubled hospital in Fredericksburg was caught up in larger forces. Since 2010, more than 50 rural hospitals have closed across the country, and hundreds more are at risk. Rural populations have declined, and in many places, those that remain are largely elderly or uninsured. At the same time, congressional budget agreements and the Affordable Care Act reduced Medicare reimbursement and subsidies for the uninsured, revenue losses that many rural hospitals have been unable to withstand. Deep in the Texas Hill Country, the hospital in Fredericksburg was poised to face a similar fate. Despite the area's live music scene and strong tourist economy, the hospital was the town's largest employer and cherished for much of its history. When it opened in 1971, 93% of the county's households contributed money, and thousands of people lined up to have a first look. Years later, as the hospital faced the crisis of Quinn Cott's death, Dr. Williams was determined to bring back that spirit. He studied the Toyota plant in San Antonio and hired former Toyota employee Jeff Darnaby to help bring the car company's revered assembly line principles to Hill Country Memorial.
The Toyota production system basically allows you to identify waste and remove that waste from your processes. Anything that doesn't add value to the customer, to the process, is considered waste.
Today at Hill Country Memorial, each department candidly displays specific goals for everyone to see: reduce ER wait times, eliminate falls, and improve customer satisfaction.
This is based off of the top 5 board that we brought here from Toyota. We didn't meet this goal yesterday. Here's what we're working on today, so I know I need to go get in this.
And this isn't something that's just measured once a year or every quarter. These are sort of real-time feedback.
Yes, it could be down to daily tracking and reporting.
In addition to Toyota, Dr. Williams turned to a former executive with Southwest Airlines to remake the hospital's values and culture. And he hired a former trainer from Ritz-Carlton, known for its legendary customer service, to change how patients and families were treated.
We took the approach that if we took patients and we treated them better than they'd ever been treated before, then at the end of the day, they would drive above the bottom line.
7 years after Quinn's death, Hill Country Memorial now ranks among the top 100 hospitals in the country, and recently won the nation's highest presidential honor for excellence through innovation and leadership. The sweeping changes can be seen everywhere, from smaller efforts like reducing food waste in the kitchen,
I have problem, I have my cholesterol, high cholesterol,
to helping local workers like Domingo Gallegos get healthier with free nutrition counseling and access to the hospital's wellness center, and to more far-reaching initiatives planned out in the hospital's so-called war room, where new ventures are hatched to improve care and grow the business.
A lot of patients come to class thinking they're going to cut out this much of my leg. And
to capitalize on the abundance of Medicare-insured retirees in Texas Hill Country, the hospital developed a well-regarded hip and knee replacement program.
Total knee replacement means they're resurfacing both sides of the knee.
That program has attracted patients like George Branice. At 72, Branice is a 5th-generation Texan from nearby Mason. He's a rancher and chairman of the local bank. After a riding accident a few years ago, Branice sought care from a renowned surgeon in San Antonio. When the hip surgery failed, he decided to try Hill Country Memorial. Branice says his surgeon and nurses were so exceptional that he was back on his horse in 4 weeks.
They take such good care of you. It's like doing business in a small town bank. They give you their cell numbers. They say, now if you have a problem, you call us. Try this with one of the big city hospitals. Yeah, it doesn't happen.
The hospital now performs some 400 hip and knee surgeries a year and markets its nationally recognized program well beyond Texas Hill Country.
Top decile.
Jane Pope became CEO of Hill Country Memorial in 2013. She attributes much of the hospital's success to its fervent and never-ending focus on improving patient care. Efforts, Pope says, that don't need to cost a lot of money.
We know
as a rural center, we can't do everything. But what we do, we determine what those core competencies are, and we invest in those skills so that our patients have the best of care.
But not every rural hospital can replicate Hill Country Memorial's success. Len Nichols, a health economist at George Mason University, says many small towns simply can't sustain an acute care hospital.
We probably have roughly 20 to 30% more hospital beds than we actually need. And so who's going to lose in the long run? Well, it's going to be those hospitals that are the least efficient, those who cannot deliver good quality services for the lowest possible cost.
Instead, says Nichols, the dozens of rural hospitals that have closed and hundreds more at risk should consider converting to urgent care centers and partnering with larger regional hospitals. That would allow rural residents to be stabilized and move quickly to hospitals where doctors often have more expertise. Brad and Cheryl Cott say the changes at Hill Country Memorial came too late for their family. They're still haunted by the treatment their son Quinn received and the hospital's ad campaign that trumpets its care as remarkable.
At first, it makes me sick to my stomach because the hospital was not remarkable at all. And it just, it tears at you when you see a billboard that says that. However, I know that it has transformed into that, and it makes me proud that people in my community took a bad situation, took our tragedy, and worked to turn it around.
For the PBS NewsHour and Kaiser Health News, I'm Sarah Varney in Fredericksburg, Texas.
And you can watch the first part of this series that explores the struggles hospitals in rural Georgia are facing on our website, pbs.org/newshour.